Hello, everybody. Welcome to this episode. Again, it's Rozalind.Zife on Diabetes Rozalind.Zife. So now, in this very episode, we are going to address how you could manage or treat type 2 diabetes by way of medical assistance. We have gone through a lot about what is type 2 diabetes. We've talked about the risk factors. We've talked about how you can manage or reverse it by lifestyle modification. Lifestyle involves diet and exercise. And I'd like to remind us also that lifestyle modification is actually superior to medication based on research evidence. So I always will continue to emphasize the need for us to really focus more on lifestyle modification even as we use medication. I'd like to also note that even if lifestyle modification does not exactly work for you, it doesn't mean you failed or you've not done enough. It only means that at this time you might be needing some support, some assistance, and that is what medication is out there for. We will continue to work on this. This is interaction session only. We are not here to prescribe any form of treatment, but it's interactive session only, information session only, whereby if anything goes wrong, you need to get to your doctor. And we are not here, I'm not here representing any organization. This is just for us, Diabetes Rozalind.Zife. So this is purely for the management of type 2 for now. We're going to address the management of all the types of diabetes in all the oncoming episodes. So here we are going to focus on mostly medication. There are different approaches to medication, which eventually we are going to go through. There is monotherapy, which you might just do one type of medication. Typically, we tend to start with metformin, which is glucophage. So there is either monotherapy, dual therapy, or multiple therapy. There's also insulin injection. So these are the things we're going to quickly deal with in this episode. And I'd like us to really pay very close attention, because the benefit is when you are consulting with your healthcare provider, with the benefit of the information you have from this channel, you will be able to ask the right questions, or you will arm yourself with knowledge, because remember, knowledge is power. That way you are well informed about any type of treatment that is being prescribed for you and know if it actually suits your personality and for what you do. So let's really get on with this and see how far we can understand it. Diabetes journey. So let us still remember the risk factors for type 2 diabetes: lack of exercise, unhealthy eating, overweight, family history, increase in age, some ethnicity, and also if you had diabetes in pregnancy and impaired glucose tolerance. The cornerstone for type 2 diabetes management is typically lifestyle modification, which is physical activity and diet. Type 2 is the most common type of diabetes. 90% of people with diabetes do have type 2. And we do remember that is when your body is not able to make good use of the insulin you've produced. This journey is not going to be a hard one if we really go by what it does require. So I've chosen to approach this management strategy by ways recommended by International Diabetes Federation and also the ways recommended by Diabetes Canada. There's not much disparity, but I'd like to take into consideration the fact that the International Diabetes Federation cuts across all nations. They deal with all nations more. Like Diabetes Canada is more of Canadian population. So the slight difference in the recommendation of treatment approach is still there. But at the end of the day, it's up to you. It's at the discretion of the doctor and what works for individuals. So for International Diabetes Federation, first line management, they will want you to go by metformin, which is glucophage, and then dual therapy, second line management. They do recommend that you can do sulfonylurea, but they always point out that glibenclamide and glyburide should not be the first choice. There are other sulfonylureas like glycoside and all the rest of them. That is what they recommend. So what I'm going to be addressing right now is recommendation by International Diabetes Federation, and then after that, it's recommendation by Diabetes Canada. So for monotherapy, IDF 2017 recommend metformin as a preferred drug of choice. It is also recommended that to maximize tolerance, we need to titrate the dose from at least 500 milligrams to 200 milligrams per day, and this should be prescribed with food or after food. And to further maximize tolerance, we could use extended release if necessary. So for dual therapy, a second glucose lowering agent can also be ordered, for instance, sulfonylurea. And we can also use DPP-4 inhibitor and SGLT2. GLP-1 receptor agonists can also be used if weight management is an issue, but you need to always consider the patient's profile, like age and complications and long-term conditions. So now for Diabetes Canada, I'll go into more details about talking more about how those medications work. First of all, is the metformin, and then second one is a DPP for second line management, or the DPP-4 drugs. And when we talk about these ones, we are referring to some medications which I'm going to list as we go on, just for us to note that different. Remember, it will always be at your doctor's discretion. And you knowing what these medications do help you to help the doctor determine the best line of management for you. Knowledge is power. Okay. So for Diabetes Canada, metformin or glucophage is the first line of management for type 2 diabetes, with its various beneficial functions already listed for you to have a good look and see how that works. So for Diabetes Canada, the second line glucose lowering agents are the DPP-4 inhibitors, and these are the gliptins like Januvia, Onglyza, and Tradjenta. The functions are clearly listed if you take your time to read through. Following that are the GLP-1 receptor agonists, and these are really non-insulin injectables, which are really wonderful drugs. They are the tides, such as the Victoza, Trulicity, and so on. So following closely are the SGLT2 inhibitors. They are called the glifloxins. For instance, we have the Invokana and so on. They are very weight effective and cardioprotective. The next line are the insulin secretagogues or the sulfonylureas. These medication make your pancreas produce insulin. Just be careful about the possibility of weight gain attributed to sulfonylureas. The thiazones, which are Avandia and Actose, just like metformin, they increase the body's sensitivity to insulin. The side effects we need to watch out for are increased risk of heart failure and possibility of weight gain. Insulin therapy sometimes is a necessary requirement for someone with type 2 diabetes, but this is quite individualized and your doctor will decide that with you. I'll talk more on insulin therapy when I address type 1 diabetes. Hello, so we've gone through all these, and it is my hope that you've taken one or two things home today for you, for your family, for a friend, whoever it is. You can always replay this again and again for a better understanding. For now, I will strongly recommend that you subscribe to this channel so you can always follow episode by episode. Right, see you in the next episode. Take care now.